No one knows more about what's going on with your health than you do. That's why it is so important to team up with your doctor to be your own advocate to get the care that you need. Dr. Scott Ackerman is one of the First Coast's leading oncologists. He joins us every Friday to talk about important health issues such as this. First of all, I mean, this is such an important thing because your doctor cannot read your mind. If you do not have a good communication link with your doctor, then how can they accurately know what's going on with you?
He or she can't, and that's why it's good to be an advocate for your own health. Research has shown that patients who take an active role in their care do better. They have better satisfaction in their care, they have better outcomes, they're cured more often. Being informed and being a responsible partner in your care is very important. Your interaction with your doctor, really, and I find this with my patients, it's really a team approach. You need to be a partner with your physician in your care. You're going to be given instructions as to what to do. You have to be a partner, question that, understand that, and make sure you're a good partner with your physician in your care.
And honesty being the key. If you hold things back because you might be nervous or something or afraid to tell your doctor, it's not going to do you any good.
Correct.
Let's go over some of the tips that you have, because the first one that you really want to highlight is effective communication. I guess that goes towards the honesty approach. It's being really truthful with what you want to say.
Well, effective communication is a two-way street. I speak to patients all the time, and frequently you get a blind look from a patient and they're kind of nodding yes, yes, yes. And I know as a physician they really aren't understanding what I'm saying. And so if you don't understand something, ask the physician a question. Don't be afraid to. Ask questions. Ask for clarification. It'll make it so that you understand things and you do things properly. I find it very helpful. Another tip for patients to bring a list of questions with them. If they have their questions with them, they won't forget something if they have a nice list. So make sure when you're home, before you go to the doctor, about whatever it is, if you're seeing their doctor for diabetes or for heart disease, put a list of questions you have, questions about medication or prognosis or whatever it might be. Put these questions down and make sure they're all answered. Nothing makes me happier when a patient says, wait, doc, I got 2 more questions here I got to ask you before you leave. That's great. I sit back down, I don't rush out of the room, and we get those questions answered.
Yeah, and nothing is worse, I'm sure, than when you're in the car driving home, you're like, gosh, why didn't I ask what I wanted, the whole reason why I went there, and I forgot.
And then you got to call and hopefully get through the physician or get through, or you talk to the nurse. It's not the same. It's not the same as face-to-face. Also, be upfront with your physician about concerns with the cost of care. A lot of people don't want to talk about that, but the physicians and their staff want to embrace that with you and make sure you understand that. Everyone's happier if you put things on the table. So talk to your physician about treatment costs, about health insurance coverage. You don't want any surprises later. And I certainly don't want my patients to have a surprise later when they get a bill and they say, oh my God, this wasn't covered. Why didn't I know this? Or there's confusion about the bill. So, and when patients kind of internalize that, that's never good. So talk to your physician about it, or talk to his or her staff about it, so you understand what's covered, what's not covered, what will your out-of-pocket expenses be. The physicians know, like in my office, we have resources to help patients that have financial challenges. And we know what resources, either we have resources or we know resources in the community that can help patients.
All right, we want to get through these next few. Talking about researching your doctor and your treatment facility, I mean, you got to do your homework.
It's important you know who you're entrusting your care to. Is the facility you're going to accredited? Is the physician board certified? How many procedures did that person perform that is similar to your procedure? Does the facility offer the support and other services that you might need?
And also seeking a second opinion. You say here that if you feel that necessary, then go do it.
I have patients all the time tell me, I didn't want my doctor to know I'm coming here because I don't want to offend him by him knowing that I'm getting a second opinion. Please don't tell my other doctor. That's a crazy thought. Physicians never mind about someone getting a second opinion. Truthfully, we as physicians welcome second opinions for our patients. It reassures them that they're having the right treatment. If a patient of mine gets a second opinion, that's great, because they usually come back and they're very confident in the treatment that I'm offering to them. They have more confidence in me. It's a good thing. So never be afraid to get a second opinion, and don't think your physician will be offended. If he or she is offended,
you got to find a new physician.
Exactly.
Yeah.
Exactly.
Okay. And then know your body. How important, you say, that is something that you should obviously be aware of.
Well, I think it's important that patients know some basic things about their health. I think you should know your weight. Simple things. I think you should know your cholesterol. I think you should know your blood pressure, because those things change over time. And those are three things that I talk to you about a lot. I talk about body mass and
Sure.
obesity, so that's weight. We talk about cholesterol when it has to do with heart disease, and blood pressure, heart disease. These are very, very important things. And so it's good that you know that. So when you see your physician, you could speak to that, and you know what lifestyle change you need to make to get those more in tune. Also, know what medication you're taking and how much. It's very frustrating to me when a patient says, I take this pill for my headaches. Well, what pill is it? I don't know. So it's very important you know your medications. If you don't know them, bring them in with you so you go over it with a physician. And also, know your body so that you can, so if something changes, you can be proactive about it.
Dr. Ackerman, as always, sir, thank you so much for joining us and your invaluable advice. And thanks so much to Dr. Ackerman, of course, for sponsoring this segment. If you have any questions regarding this topic or any other health questions that you might have, you can visit Dr. Ackerman's Facebook page, which is simply facebook.com/First Coast Oncology.